kena share with my friends, Intan Suraya, Nur Alisa Atira, Nur Aliana, and Putri Nadia, gonna present our case study entitled Beta-Thalassemia, Medical and Surgical Consideration in Managing Facial Deformities, Case Report and Review of Literature. Thalassemia is an inherited blood disorder that causes human body to produce less hemoglobin than normal. There are two types of thalassemia, which are alpha thalassemia and beta thalassemia. Alpha thalassemia is caused by reduced or absent synthesis of alpha globin chain, while beta thalassemia is caused by reduced or absent synthesis of beta globin chain. There are two types of beta thalassemia, which are beta thalassemia major and beta thalassemia minor. Beta thalassemia major occurs in the homozygous state and involves two damaged genes, while beta thalassemia minor, which also known as beta thalassemia 3, occur in the heterozygous state and involve only one damaged gene. Patients diagnosed with beta thalassemia major usually require frequent blood transfusions, while patients with beta thalassemia minor have 50% chances of passing genes to their children. Case study reported a 27 years old Jamaican male with a beta thalassemia intermediate history. Patient was referred to the oral and maxillofacial surgery department for evaluation of his facial deformities. Patient was first diagnosed with beta thalassemia at the age of 10, and he had underwent a splenectomy. From the age of 10 to 13 years old, patient's hemoglobin was maintained without blood transfusion. Patient's father and his two sisters had the beta thalassemia trait, but they showed no hematology or clinical symptoms. Patient mother had died of renal failure. However, there is no record about the death. At the age of 13, patient first noticing changes in the configuration of his face, and in his early 20s, patient had additional maxillary overgrowth rings. Patient is to next presented. Thank you.
Okay, Assalamualaikum. My name is Nur Alisa Atira and I will present on the pathophysiology. Right, so as we know, in normal adult hemoglobin, there's 4 structural subunits which consist of 2 alpha and 2 beta globins, right? So it will like together like this. And when there's an absence or underproduction of beta chains, it will then lead to an amount of unpaired alpha chains. So then it will become unstable and then will precipitate themselves into erythroid precursors in the bone marrow. And when that happens, it will cause the membrane damage and also cell death. And as a consequence, the hypertrophy of the erythroid marrow will take place, and then it will cause the deformities of the skull. And when that happens, the structure of the face also will change. Right, so that's all from me. I will pass it to the next presenter. Thank you.
Assalamualaikum and hi, my name is Putri Nadia. So now I will explain about clinical features or sign and symptom of beta thalassemia. As you can see on the slide here, this is the clinical features or sign and symptom for beta thalassemia. First, deformities of the skull and face, which is mean the structure of the skull and face will not look like a normal person's due to lack of beta chain. The clinical features for deformities of the skull and face are prominence of cheekbone, depression of nose, and protrusion or flaring of the maxillary anterior teeth. Also, deformities occur because of marrow proliferation due to chronic anemia. Next, displacement of the dentition by the marrow, which the problem occur around the mouth part. So, the clinical features or sign and symptom for displacement of the dentition are malocclusion, difficulty of mastication, swallowing, and speech. Next is the clinical features or sign and symptom that you can obtain from the case report. At the age of 13, the patient noticing change in the configuration of his face with maxillary overgrowth and severe dental deformity produce progressive disfigurement and difficulty chewing. Maxillary overgrowth on his left side and also cause severe lip incompetence, which he cannot close his mouth like a normal person. Then, gingiva pale pink with blue vascular pattern occur. Lastly, on the radiography examination showed widening of the medullary space and thinning of the cortices with complete obliteration of the lateral cortex on the left maxilla. Then, the marrow expansion within the maxilla reduced in a reduction in the volume of maxillary sinus pneumatization. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Deformities. So today I'm going to present the investigation and finding for this case study. So basically in this case study, there is physical examination, radiographic examination, and also laboratory examination. So we start with physical examination first. So basically the first picture for this physical examination is a preoperative frontal view, and then the second picture is the intraoral view, which is show the compensatory major deviations of mandibles. Okay, next we go for the radiographic examination. So the first picture is a panoramic radiography, which shows the expansive maxilla overlapping mandibles, circular regulancy in anterior mandible. So it's consistent with thalassemia, osteopenia. So the next one is the pictures for the frontal lateral two-dimension reconstruction from a computer tomography that show an extent of a massive facial lax of cortex. So the next one, we're going to go for the lab examination. In the lab examination, they show an extreme variations of parietal level, which is 26,000 of nanograms per deciliter. Supposedly, the normal parietal levels is between 22 to 332 nanogram per deciliter. So in an attempt to detect any iron overload organ damage, an echocardiogram was performed, and the fact that the echocardiographic findings were normal, they suggest the abnormal periodic elevation to the parietum was not reflective of tissue iron. So the patient's hemoglobin in this case study is 9.5 gram per deciliter, which is the baseline ranging from 8.5 to 10 gram deciliter, 8.5 to 10 gram per deciliter. So chromatography was remarkable for 100% HGL, with complete absence of HGA and HGA2. And then the next one is a genetic analysis, which showed the homozygous nonsense mutation in chromosome 11. This is resulting in non-structurable alpha and beta globin. So the absence of alpha and beta globin result in a compensatory increase in gamma globin, which constituting of 100% of the patient hemoglobin HGL. So in an attempt to create an optimal post-operative healing environment, the patients underwent preoperative erythrocytosis and exchange transfusions of CU packed red blood cells. So that's all from me. I pass to the next presenter. Thank you.
Hello there, my name is Noalina and I am the last presenter for this video. Now I will be talking about treatment and medication for the thalassemia. Usually, doctor use three standard treatment, which is blood transfusion, iodination therapy, and folic acid treatment. And another treatment such as bone marrow and stem cell transplant are used less often. And for the blood transfusion, it is to restore the normal and healthy level of red blood cell and hemoglobin. And for the iodination therapy, it is to remove the excess iron in the body. And for the supplement, folic acid will help in making the red blood cell and regulate the iron function. And for the bone marrow and stem cell transplant, it is to replace the faulty stem cell with a healthy one for another healthy donor. So based on the case study, pre-operative hemoglobin optimization is applied. The benefit of the pre-operative exchange is to correcting the chronic anemia, qualitative conversion to the normal hemoglobin, and for the and oxygen affinity. and also for the correction of the hypercoagular state. So the next is a laboratory analysis is necessary for multi-organ assessment because cardiovascular impairment are the leading cause of death in the patient with thalassemia. So the routine chest radiography and electrocardiography are mandatory. Doppler echocardiography is usually used to detect the cardiac function and to detect the failure. The case study report the surgical management of the thalassemia semi-induced facial deformities with the repositioning and the contouring the maxilla. And to avoid the recurrences, a myelosuppressive agent such as the hydroxyurea is used to maintain the hemoglobin at the 10 g per dl to reduce the marrow activity. That's all from us. Thank you.